through the phone of the victim, it is not very easy to detect. There are some common manifestations of cyberbullying. They are cyberstalking. This usually happens when there was a nasty breakup. The victims of cyberstalking get to receive bouts of texts that are not needed from their ex-partners. These messages are usually sexual and sometimes they have elements of threats and violence in them. Harassment. Victims of cyberbullying always receive continuous texts that are hurtful and cruel. These texts can be done via SMS or social media platforms. Denigration. This means destroying other people's relationships or personalities by posting degrading rumors and gossip about them. Outing. This talks about the sharing of photos or information with the intent of exposing another person to the public. These photos or information are photos of a former partner, and they usually have messages showing the orientation of the victim sexually. Impersonation. This refers to ridiculing another student by spreading rumors about them. Usually, students that do this pose as the other students that they want to ridicule. Other facts of cyberbullying. From the studies carried in the United States, here are some facts that were discovered about cyberbullying. About 12% of students have been involved in cyberbullying another student. Teenagers who are overweight are at a greater risk of being cyberbullied. LGBTQ students have been victims of cyberbullying more than other students. Statistics show that about 42% of LGBTQ students have been victims of cyberbullying. Relationships. One of the major leading causes of cyberbullying for teenagers is relationships. The romance of teenagers of the romantic relationships that teenagers get involved in is usually filled with youthful memories of fondness. Although, sometimes, these relationships can be unhealthy, and it can result in a breakup. This breakup can lead to a very grave mental illness for teenagers. The reason a lot of teenagers end up in a breakup, resulting from unhealthy relationships, is that most teenagers are usually not experienced when it comes to romantic relationships. This inexperience in romantic relationships produces poor responses when they get disappointed in their relationships, and this disappointment influences their school performance and the way these teenagers behave at home. According to behavioral science, a lot of mental health issues among teenagers have been linked to difficulties in post-relationship and breakups. Apart from mental health issues, suicide and self-harm are also products of breakups. Stress from school. When the stress level is normal, it is usually not a problem. The world today has everything moving at a very fast pace, and a lot of activities involved in our world today have led to increasing levels of stress among teenagers. This increasing stress level has led to a lot of mental disorders. The stress level for teenagers today is so high, and even with the height of the stress level, a lot is still expected of them. Teenagers still have to juggle school and other extracurricular activities like sports and then their relationships with others. This stress doesn't exempt the teenager from being under the pressure of having a good social media identity. As the stress levels are on the increase, some of these teenagers do not know how to manage this stress and balance other aspects of their lives. This is why a lot is required from parents who have teenagers living with them. If as a parent you find out that your child is stressed, calm the child down, and have a discussion with the child concerning how to work on stress and balance fully every other aspect of life that is not school-related. This will help the child stay out of most of these stress-related disorders. One of the anxiety disorders that can come from increased stress levels is a depression or prolonged extreme sadness. A lot of other teenagers also get these overwhelming feelings from stress. Divorce and family issues. Most of the mental disorders that teenagers have do not come from school or relationship-related problems. Most of the disorders are simply an offshoot of family issues or separated homes. If a child is going through the motions that come with being divorced, then the child may have to have mental disorders as the result. Also, family issues that have to do with finances can get a teenager to the point of mental disorders like anxiety and depression. This is the reason parents should know how to handle their interpersonal conflicts. This will save the teenager from a whole lot of mental stress and help build a positive mental habit for the teenager. The teenage phase comes with a lot of worries that can keep teenagers awake thinking about it. Parents should know how to handle their problems, to exonerate the teenager from further thinking of issues that have to do with them. Issues like being laid off from their jobs and dispute between themselves. One way to do this is to let your children know that it is your issue and not their issue, and because it is your issue, they should not worry about it, you have everything under control. You must keep giving these teenagers the impression that everything is okay and being properly handled, if not you will get to the point of wanting to help in the situations. To some of these family problems, they might not be able to proffer a solution, so you will just get them to worry about a problem that they will not be able to solve. This in itself will add a lot of stress and pressures to the already existing stress and pressures they are facing as teenagers, and this is capable of increasing their chances of being disorder mentally. If care is not taken to save these teenagers from these extra worries, they will become anxious and eventually get depressed. Here are some of the findings from studies conducted on mental disorders associated with family issues and divorce. In 2015, it was discovered that problems associated with family relationships were a leading cause of mental issues for teenagers. This finding was from a survey carried out by the British Adolescent Mental Health Service. It was also discovered from a survey conducted by the APA that the third largest cause of stress from teenagers is financial issues in the family. The Journal of Family Psychology showed a published study that concluded that children from families that are divorced have behavioral problems in large numbers. Chapter 5. How to recognize teen mental health conditions. Depression. Depression can be caused by several factors. Factors such as bullying, stressful relationships, genetic makeup, or predilection towards a particular physical health disorder. The very important thing to note about depression is that no matter the underlying factor causing depression, it is not uncommon among teenagers. In the USA, at least over 3 million teenagers witness depression yearly. Signs of depression. Depression doesn't just show up unawares, pointers are showing that someone is about to, or is going through a depressing episode. These signs are: staying away from home for a long period, addiction to the internet or excessive smartphone usage, bullying other teenagers, acting violently, constant unprotected sex, alcohol addiction and drug abuse. Once you begin to notice one or more of these symptoms, the best thing to do is to have a dialogue with the teenager involved. The reason you need to take immediate action is that it has been reported that teenagers' depression is usually not treated adequately if eventually they are reported. The normal is that most cases of depression are usually underreported. So once you notice any of these signs as a parent, open a dialogue with the teenager and report the case to a psychologist for adequate treatment. Over 60% of depression episodes from teenagers do not get adequate care, so as a parent, you must ensure that such a child receives adequate treatment by following up with the child on the treatments. As you determine to open up a dialogue with any teenager you see one or more of these signs of depression in, you must understand that you will not make any significant progress if you decide to force your way through them telling you what is happening to them. One of the very major challenges that teenagers have is that they are always almost reluctant to open up to the older generation. So in dealing with a teenager that is going through a depressive episode, patience is key. They might not outrightly begin to pour out their heart to you at first, but if you are patient with them, and they trust you by seeing that you mean well and not harm to their mental health, they will begin to open up, and then that is when you begin your job properly of helping them out of the situation. Other facts about depression. Most of the teenagers with major episodes of depression were impaired severely. Up to half of the teens going through a major depressive episode have families containing one person who is either depressed or has related mental illness. The rate at which depression occurs in females is higher than the rate of occurrence in their male counterparts. Anxiety. Anxiety is common among teenagers that are stressed. Anxiety has been talked about in the previous chapters of this book, but in this chapter, we will delve more into this mental disorder and see the intricacies involved in this particular mental disorder. These particular intricacies involve the severity of this particular mental disorder, and how to handle it if as a teenager and as a parent having a child going through this particular mental disorder. In the USA, about the percentage of teenage boy and girl folks that go through this mental disorder is over 20% and 30%. The total number of these teenagers total up to about 6.3 million. This particular mental condition is not considered as severe as depression, This, however, doesn't mean that it is not a serious mental disorder to be considered. Anxiety is one of those mental illnesses that should be handled with so much urgency. This is because if it is not handled swiftly and carefully, the impact can be so mentally and physically detrimental. The likeness of this particular mental disorder as compared to depression among teenagers makes mindfulness one of the major ways of coping with it. Mindfulness involves engaging in the simple art of meditation and using various techniques of relaxation to downplay this particular mental disorder. This particular mental disorder is a resultant effect of school-related stress. Schools that understand that this particular mental disorder is school-related have inculcated into their curriculum subjects that will teach teenagers these techniques, and these techniques have been working effectively as tackling anxiety that is as a result of school stress. A lot more number of teenagers go through this particular mental illness. When compared to the number of college students that go through depression, the number of college students that go through anxiety is double. This means that we have more number of students going through this particular mental disorder than we have who are currently going through depressive episodes, and the percentage of students that get to fully receive proper treatment from this disorder is just about 20% of the total number of students going through it. Issues with body image. A lot of teenagers express dissatisfaction with their bodies. They feel they do not look good enough, because they see a lot of skinny models that wear lots of expensive clothes parading themselves on the streets, on television, and all over social media. More than half of teenage girls in the USA express dissatisfaction over their bodies. At age 13, over 53% of girls are not satisfied with how they look. When they begin to get to 17 years, the number of dissatisfied teenage girls increases by 25%. Once it comes to having issues with body images, teenagers are very vocal about it. They always voice out how they wish they looked, and they go as far as dressing to look like the person with the kind of body image they will want to have. So teenagers that have body image issues can be spotted out fast. Aside from dressing to look like the person with the perfect body image that they desire, they go as far as following the person on their social media platforms, and even using the person's image as wallpaper on their smartphones. A large number of these teenagers eventually get obsessed with these models that have their dream body image. When you begin to see these signs in teenagers, open a dialogue with them and help them see how beautiful they look. Teach them how to be comfortable in their skin. This will be easy for the parent if the teenager loves and trusts you. Do not stop complimenting their look and their body shape till they come to terms with the fact that they are beautiful the way they are. Do not stop telling them to take their eyes off the representations in the media that are not realistic. This will help them come out of this problem. They may have a lot of other issues to battle with, issues like peer pressure and social media. So, your constant communication and reassurance will go a long way in helping them come out of the low self-esteem and dissatisfaction they have about their body image. Eating disorders. Apart from the signs, you will see from the words and smartphones of these teenagers that are not satisfied with their bodies, the following actions will let you know when teenagers are dissatisfied with how they look. These actions are directly linked to eating disorders like skipping or avoiding meals, excessive mirror examinations, instant loss of weight. These teenagers may be suffering from anorexia or bulimia. There are a lot of severe health consequences that can come as a result of eating disorders. This is a major reason it should be handled using coordinated methods involving family and therapy, and this intervention must be done early enough. In the USA, according to the National Institute of Mental Health, about 2.2 million teenagers in their lifetime suffer from bulimia and anorexia. Out of this number, about 70% do not go for medical treatment. Addiction and abuse of substance. One of the ways that teenagers cope with stress is by using illegal drugs and alcohol abuse. The increase of addiction and substance abuse by teenagers in the United States is a major issue of concern. About 2.5 million teenagers use illicit drugs regularly. These teenagers fall within the ages of 12 and 17. The use of these drugs and substances alleviates the user temporarily from whatever stress-related mental disorder the person is facing at the moment. It is also important to note that teenagers are not the only ones to resort to the use of drug abuse and alcohol. People of the older generation do too. Excessive social media use and smartphone addiction. The number of teenagers that have access to smartphones has increased drastically. There is no problem with teenagers owning a smartphone, but owning a smartphone becomes a problem when there is excessive use of the same by these teenagers. This excessive use can cause depression and unhappiness. It has been proven that excessive use of social media can lead to sleep and eating disorders. Also, a recent study has linked a chemical imbalance in the brain of teenagers with the excessive use of smartphones. Studies have shown that teenage students who get involved in physical activities and spend time interacting with people in real time are happier than those that spend most of their time on their smartphones calling, texting, and using social media. This is why you need to talk to your teenagers about the dangers of spending all their time on their smartphones. If they know that those who spend less time on their smartphones are happier than those who spend more time, they will limit the amount of time they spend on their phones. The amount of time spent on their smartphones can be regulated to between 1 and 2 hours daily. By doing this, they will spend most of their time interacting with other teenagers in real time, and they will be happy like those who spend less of their time on their smartphones. Self-harm. A lot of teens cut themselves when they are trying to manage anxiety and pains, especially emotional pains. The reason they resort to harming themselves to get rid of all these other forms of pain and anxiety is that they are trying to distract themselves. When teenagers are going through emotional pain, especially such that it is overwhelming, to get distracted from the emotional pain, they will try to inflict physical pain on themselves. This will help them take their mind away from whatever is causing them the pain and from the pain itself, and then they will focus on the physical pain. By doing this, they automatically get a break from the physical pain. It is most likely that teens who harm themselves are prone to suicidal attempts, and they have suicidal thoughts go through their minds often, but this is not the case all the time. Some teenagers just stop at the level of self-harm. Spotting those who might have suicidal tendencies can be very difficult, but it is very possible. People who harm themselves are usually not very vocal, but they have signs they show by their actions. They find it difficult to express themselves in words and communicate their pains to others. This is why self-harm is a very big issue and should be tackled with all seriousness. You might not be able to tell those who just stop at harming themselves, and those who proceed to suicide. To deal with the problem of self-harm, psychotherapy must be involved because of the level of severity that might be attached to it. It is recommended that teenagers that are always hurting themselves should undergo an inpatient program for 30 days. Then, to further help any teenager in this dilemma, try as much as possible to engage the teen, as you will do for a depressed teenager. This might look a bit difficult at first as they might not be willing to open up, but with firmness and gentle approach, you will get them to start talking. Again, patience is always the key for such teenagers. If these teenagers are not given adequate treatment on time, the majority of them become suicidal and eventually commit suicide in the forthcoming year. Suicide. For every parent who has a child of teenage age, suicide has to be the worst nightmare for them. Sadly, this nightmare seems to become an everyday reality in the United States, because the rate at which teenagers are committing suicide is on the increase daily. This is why any evidence of suicidal tendencies or thoughts must be treated with serious urgency. The signs of suicidal tendencies are almost like that of depression, though there are a few additional signs. Suicidal talks or being fascinated with death. Giving cherished possessions to people as gifts. Activities they once enjoyed now bring apathy. Behaving recklessly and taking unnecessary risks. Body marks or scars showing self-harm. Calling the names of old friends and relatives that are not alive for no reason or out of the blue. One of the major leading causes of death for teenagers is suicide. This factor is the third major factor. So if you notice any of these signs as a parent or a loved one, you ought to report to the appropriate authorities immediately. Contact the National Suicide Prevention Team. Other facts about suicide. About 4,400 people die in the United States by committing suicide. Every teenager has had at least 100 suicidal thoughts or attempts. At least one teenager dies by committing suicide every 100 minutes. Chapter 6. How to maintain good mental health for teenagers. It is already a fact that teenagers become adults that we eventually see in the environment. Whatever beliefs and convictions they hold firmly as teenagers will become what they will live by as adults. This means that their mental health as a teenager will reflect maximally in their adulthood. So when mental disorders are not taken care of, they become the added challenges that these teenagers will face in their adult phase. They will be added challenges because the adult phase comes with its challenges. This is why it is paramount that as teenagers, not only treating mental conditions, but also maintaining it is very paramount. Certain things can be done for a teenager by their parents, guardian, or loved one to help them keep positive mental health. These activities are not new, and they are not unusual. Below are the things to be done for teenagers to maintain a positive mental health. Keep a constant and an open communication. This has been repeated in this book a lot of times. It has been one of the first approaches a parent must take as well as the teenager to help the teenager come out of mental disorders. The reason this is first is that a shared problem is usually half solved. So if the teenager will be willing to keep an open and constant communication, then it will not be very difficult to help the teenager either come out of an underlying mental disorder or maintain a positive mental attitude. Here is how to keep the communication constant and open. Avoid lecturing them. When we talk about maintaining open and constant communication, it is important to know that what is being referred to is not lecturing the teenager. Mentally disordered teenagers will not respond positively to lectures that seem to patronize them. Communicate with them firmly, hit the nail on the head, but do it patiently and gently. Do not handle the communication like a cop. Pay attention to them. People do not care about how much you know until they know how much you care. This is true also when dealing with mental disorders for teenagers. One of the ways to show them that you care as a parent or loved one is by listening to them, allowing them to do the talking at first. When you do this, you might discover other issues that you didn't know about. So as you are eager to communicate what you know to them, be sure you make them know that you are listening to them, and do this by actually listening to them. As a teenager, it might be very difficult to talk to people about how you feel and what is going on with you mentally, but it is the first step in the right direction. Nobody begins to help without adequately knowing what to help in. So be open once you know or begin to see that the person trying to help is doing it out of love and care. It could be frustrating trying to help, and the help is declined or treated as if it is not needed. You have to show you want to be whole again mentally, and this is done by opening up always to the person that wants to help you for real. Pre-inform the victims of mental disorder. As a parent or a guardian trying to help a teenager, do not just invade the teenager's private space, or cause more problems by inviting the teenager for a talk without the proper information. This will look very confrontational, and there is a very huge probability that they will either lie to you, not show up for the meeting, or be in the meeting and not say anything to you. This means you will be the only one talking. The reason they will react this way is that they are not ready for any conversation at the moment, so they will do anything to get by the moment. So do not approach them for a discussion without informing them. Ask them when they will be free and ready to talk about the issue and adjust to their time. They will give you the time they will be available for the discussion, and from the time they were informed to the time of the discussion, they will spend most of their time preparing themselves mentally ready for the discussion. Don't get angry. There will be a temptation to get angry when the discussion is not going as expected, or the response from the teenager is not encouraging with all the efforts you have made. Getting angry will make the teenager hold back more, and you will have to start all over again. Remember, patience and persistence is key. Sometimes they behave like this because they are trying to settle in their minds that you want to help them. So no matter how the teenager acts, do not get angry. Even if you do not express it before them. Just stay calm and come again another time and day. Hopefully, they will be in a better mood to talk to you about the situation. Keep doing this, you may never know how close you are to get them to start talking to you. Fitness and diet. A large number of teens that are healthy and fit are happy teens, but it is so unfortunate that a large number of teenagers do not exercise as they should. The CDC recommendation for teenagers as touching exercise is a daily physical activity for 60 minutes. Then within a week, the teenagers should go through a 3-day activity. This activity is moderate to vigorous activity. Teenagers who do these weekly will have good mental health. This is because one of the proven ways stress is taken care of is through exercises. Teenagers who do not participate in fitness exercises might get overweight, and in their adult phase, they may become obsessed. And remember that one of the major leading causes of mental disorder is poor body image perception. Sleep. For the proper functioning of teenagers, about 8 to 10 hours of sleep is required every night. This finding is according to the National Sleep Foundation. While this is the ideal situation, the real situation is that teens don't get up to that amount of sleep all the time because of their academic activities and social obligations. Though teenagers may not get enough sleep for up to at least 8 hours daily, it is better than being sleep deprived. Sleep deprivation can come with a whole lot of problems, like anxiety and depression. Sleep deprivation will reduce drastically the functioning of teenagers. Some of the teenagers who are sleep deprived turn out to start behaving recklessly, having unprotected sex, and engaging in excessive alcohol use and drug abuse. As a parent or guardian, you need to let your children, especially those in the teenage age, know the benefit of sleep. You need to make them know how they will turn out when they do not have good sleep, especially at night. Even amidst the academic and social engagements, they need to know the benefits of having to sleep well. Encourage them to find out time to make up for nights that they didn't sleep as they ought to sleep. It will boost their mental health and their levels of productivity. Chapter 7. Medication and Therapy. The above already mentioned activities are things that can help teenagers maintain good mental health. These activities can also restore teenagers with mental disorders and boost productivity. Now, there are times or in some cases where these natural remedies may not work or may prove futile. At this point, you will know it is gradually going beyond what you can handle. So when all these other activities mentioned above fail to help your teenage child cope with mental issues, then the next thing to do is to take the child for therapy and counseling. Reach out to a pediatrician or a general practitioner. They will help you book an appointment with a therapist that will help your teenage child with mental issues. Sometimes, you may find the child responding to the same things that were not responded to when you as a parent or guardian prescribed it to them. Do not feel bad. You must know that sometimes, teenagers will respond more to outsiders, someone who is not a friend to a family member. They might even get more open to such people. This can be what is happening, but sometimes, it is a matter of serious psychotherapy or medical prescription. Some of these teenagers who just need someone outside of the family to talk to might get better after 6 months of receiving non-medical treatment in community clinics. While sometimes, the teenagers that have intense health disorders will need to take antidepressants to begin to see improvements, and then the non-medical treatments will begin to become productive. The antidepressants may take up to 6 weeks before it starts making them feel better, and once they start feeling better, the other non-medical remedies will begin to work effectively. It is easy for parents to identify their child's physical needs: nutritious food, warm clothes when it's cold, bedtime at a reasonable hour. However, a child's mental and emotional needs may not be as obvious. Good mental health allows children to think clearly, develop socially, and learn new skills. Additionally, good friends and encouraging words from adults are all important for helping children develop self-confidence, high self-esteem, and a healthy emotional outlook on life. Conclusion. Staying mentally healthy is so important because how we live life daily, interact with one another, and stay physically healthy is highly tied to staying healthy mentally. It is also pertinent to know that although mental health can help in living a good life daily, having good interactions and relationships with people, and staying healthy physically, these factors can also affect mental health. They are the repercussions of mental health, and any abnormality with any of these factors can also affect mental health. A very good number of people live longer and enjoy life while here on Earth because they have maintained very good mental health. They have prevented mental disorders from stepping in and disrupting their daily lives, and if for any reason they get to witness any form of mental disorder, they do not hesitate to look for help, and they handle the situation fast so that they can continue their normal life processes.